The scary truth about coronary artery disease. Imagine your heart as the engine of a car, responsible for fueling your body with life-sustaining energy. But what happens when that engine is starved of fuel? Coronary artery disease is like a slow blockage in your heart's fuel line, preventing oxygen-rich blood from reaching the vital parts of your body. The symptoms might start small, like occasional chest discomfort or feeling winded after simple activities. But over time, these signs can escalate, leading to life-threatening complications like heart attacks. In this guide, we'll uncover the warning signs and causes of coronary artery disease and explore how you can safeguard your heart. Symptoms. Symptoms of coronary artery disease happen when the heart doesn't get enough oxygen-rich blood. Coronary artery disease symptoms may include chest pain, called angina. You may feel squeezing, pressure, heaviness, tightness, or pain in the chest. It may feel like somebody is standing on your chest. The chest pain usually affects the middle or left side of the chest. Activity or strong emotions can trigger angina. There are different types of angina. The type depends on the cause and whether rest or medicine makes symptoms better. In some people, especially women, the pain may be brief or sharp and felt in the neck, arm, or back. Shortness of breath. You may feel like you can't catch your breath. Fatigue. If the heart can't pump enough blood to meet your body's needs, you may feel unusually tired. Symptoms of coronary artery disease may not be noticed at first. Sometimes symptoms only happen when the heart is beating hard, such as during exercise. As the coronary arteries continue to narrow, symptoms can get more severe or frequent. A completely blocked coronary artery will cause a heart attack. Common heart attack symptoms include chest pain that may feel like pressure, tightness, squeezing, or aching, pain or discomfort that spreads to the shoulder, arm, back, neck, jaw, teeth, or sometimes the upper belly, cold sweats, fatigue, heartburn, nausea, shortness of breath, lightheadedness, or sudden dizziness. Chest pain is usually the most common symptom of heart attack, but for some people, such as women, the elderly, and those with diabetes, symptoms may seem unrelated to a heart attack. For example, they may have nausea or a very brief pain in the neck or back. Some people having a heart attack don't notice symptoms. When to see a doctor? If you think you're having a heart attack, immediately call local emergency number. If you don't have access to emergency medical services, have someone drive you to the nearest hospital. Drive yourself only as a last option. Smoking or having high blood pressure, high cholesterol, diabetes, obesity, or a strong family history of heart disease makes you more likely to get coronary artery disease. If you're at high risk of coronary artery disease, talk to your healthcare professional. You may need tests to check for narrowed arteries and coronary artery disease. Causes: development of atherosclerosis. Coronary artery disease is caused by the buildup of fats, cholesterol, and other substances in and on the walls of the heart arteries. This condition is called atherosclerosis. The buildup is called plaque. Plaque can cause the arteries to narrow, blocking blood flow. The plaque also can burst, causing a blood clot. Some causes of atherosclerosis and coronary artery disease are diabetes or insulin resistance, high blood pressure, lack of exercise, smoking or tobacco use. Risk factors. Coronary artery disease is common. Coronary artery disease risk factors you can't control include age. Getting older increases the risk of damaged and narrowed arteries. Birth sex. Men are generally at greater risk of coronary artery disease. However, the risk for women increases after menopause. Family history. A family history of heart disease makes you more likely to get coronary artery disease. This is especially true if a parent, brother, sister, or child got heart disease at an early age. The risk is highest if your father or a brother had heart disease before age 55 or if your mother or a sister developed it before age 65. Coronary artery disease risk factors you can control are smoking. If you smoke, quit. Smoking is bad for heart health. People who smoke have a much greater risk of heart disease. Breathing in secondhand smoke also increases the risk. risk. High blood pressure. Uncontrolled high blood pressure can make arteries hard and stiff. This can lead to atherosclerosis, which causes coronary artery disease. Cholesterol. Too much bad cholesterol in the blood can increase the risk of atherosclerosis. Bad cholesterol is called low-density lipoprotein, LDL cholesterol. Not enough good cholesterol, called high-density lipoprotein, HDL cholesterol, also leads to atherosclerosis. Diabetes. Diabetes increases the risk of coronary artery disease. Type 2. Diabetes and coronary artery disease share some risk factors, such as obesity and high blood pressure. Obesity. Too much body fat is bad for overall health. Obesity can lead to type 2 diabetes and high blood pressure. Ask your healthcare team what a healthy weight is for you. Chronic kidney disease. Having long-term kidney disease increases the risk of coronary artery disease. Not getting enough exercise. Physical activity is important for good health. A lack of exercise is linked to coronary artery disease and some of its risk factors. A lot of stress. Emotional stress may damage the arteries and worsen other risk factors for coronary artery disease. Unhealthy diet. Eating foods with a lot of saturated fat, trans fat, salt, and sugar can increase the risk of coronary artery disease. Alcohol use. Heavy alcohol use can lead to heart muscle damage. It also can worsen other risk factors of coronary artery disease. Amount of sleep. Too little sleep and too much sleep both have been linked to an increased risk of heart disease. Risk factors often happen together. One risk factor may trigger another. When grouped together, some risk factors make you even more likely to develop coronary artery disease. For example, metabolic syndrome is a group of conditions that includes high blood pressure, high blood sugar, too much body fat around the waist, and high triglyceride levels. Metabolic syndrome increases the risk of coronary artery disease. Other possible risk factors for coronary artery disease may include breathing pauses during sleep, called obstructive sleep apnea. This condition causes breathing to stop and start during sleep. It can cause sudden drops in blood oxygen levels. The heart must work harder to pump blood. Blood pressure goes up. Increased high-sensitivity C-reactive protein, HSCRP. This protein appears in higher than usual amounts when there's inflammation somewhere in the body. High HSCRP levels may be a risk factor for heart disease. It's thought that as coronary arteries narrow, the level of HSCRP in the blood goes up. High triglycerides. This is a type of fat in the blood. High levels may raise the risk of coronary artery disease, especially for women. High levels of homocysteine. Homocysteine is a substance that the body uses to make protein and to build and maintain tissue. But high levels of homocysteine may raise the risk of coronary artery disease. Preeclampsia. This pregnancy complication causes high blood pressure and increased protein in the urine. It can lead to a higher risk of heart disease later in life. Other pregnancy complications. Diabetes or high blood pressure during pregnancy are known risk factors for coronary artery disease. Certain autoimmune diseases. People who have conditions such as rheumatoid arthritis and lupus have an increased risk of atherosclerosis. Complications. Complications of coronary artery disease may include chest pain, also called angina. This is a symptom of coronary artery disease, but it also can be a complication of worsening CAD. The chest pain happens when arteries narrow and the heart doesn't get enough blood. Heart attack. A heart attack can happen if atherosclerosis causes a blood clot. A clot can block blood flow. The lack of blood can damage the heart muscle. The amount of damage depends in part on how quickly you are treated. Heart failure. Narrowed arteries in the heart or high blood pressure can slowly make the heart weak or stiff. This can make it harder for the heart to pump blood. Irregular heart rhythms called arrhythmias. If the heart doesn't get enough blood, changes in heart signaling can happen. This can cause irregular heartbeats.